How to perform a blood glucose test using a ForSure Smart and ForSure Smart Duo. Before you begin, thoroughly wash your hands with soap and water. Dry your hands with a clean cloth or paper towel. We are now going to describe the steps for loading the lancing device. To remove the white cap of the lancing device, look for the small black arrow. Position the lancing device so the arrow points to the left. Using your right hand, hold the black indented sides of the lancing device. Using your left hand, hold the white indented sides of the cap. Now twist the cap away from you. The cap is now released. Set it aside. Using your left hand, load a new lancet firmly into the white lancet holder cup. To expose the needle, hold the lancet firmly in place and twist off the protective disc. Make sure you pull it off in a smooth, straight direction so the needle does not bend. It is now time to reassemble the lancing device. Put the white cap back on the device and twist it towards you to lock it in place. You are now ready to set the Lancet Depth with a range from 1 to 6. We recommend that you start at 3, and if you are struggling to get blood, increase the Lancet Depth incrementally to 4, 5 and 6. To activate the lancing device, pull the top black end until you hear a click. Verify that the dial has turned orange. Your lancing device is now loaded and ready to use. We are now going to illustrate how to perform a blood glucose test. ForSure Smart meters come with a date and time preset. When you take the meter out of the box, it is ready to use. However, we always recommend as a precaution that you verify the date and time when using the meter for the first time. To adjust the time and date, press and hold both arrow buttons on the meter at the same time until you hear a beep. Then, immediately let go of both arrow buttons. The year will blink in the bottom of the screen. If the year is correct, press M, which will save it to the meter's memory. If the year is not correct, use the arrow buttons accordingly. Confirm the correct year by pressing M. The day and month will then appear, with the month blinking. Again, follow the same steps by pressing the arrows to adjust, and then pressing M to save the month to the meter's memory. The day of the month will now begin blinking. Follow the same steps to adjust and confirm the date. When the day of the month has been confirmed, the time will now appear. Follow the same steps for adjusting and confirming the time, using the arrow keys and pressing M to save the information to the meter's memory. After the time has been set, there is an option to switch the beep sound off and to set alarms. Press M when you are ready to continue and save any changes to the meter's memory. Now that the date and time are confirmed, take the vial containing the blood glucose test strips and check the validity of the expiry date. Open the vial and remove one strip. Then make sure to close the vial properly before continuing. The strips have a blank side and a lettered side. Always make sure the lettered side is facing up. Insert the chip side of the strip into the top of the meter, and the meter will automatically turn on. The meter will perform a small check, and when the flashing droplet symbol appears at the top of the screen, it is now time to prick your finger. You can also see the letters GLU for glucose testing in the top right corner of the screen. It is now time to perform a blood glucose test. Take your loaded lancing device and ensure the button is orange. Position the lancing device on the side of your finger and press the orange button to trigger the needle. We recommend your middle, ring or pink finger, and we suggest positioning the lancet on the side of your chosen finger, as it is easier to obtain a droplet of blood this way. Take your meter with the blood glucose test strip already in the slot and let the strip absorb the blood until you hear a beep. This sound indicates that the meter has absorbed a sufficient amount of blood. The meter counts down from 4. After 4 seconds, you have your result. To release the strip, locate the button on the left side of the meter and slide it upwards. The strip will pop out and the meter will automatically switch off. Remember to have your sharp spin at the ready in order to expel the strip directly into it. Now you must discharge the lancet. To reopen the lancing device, follow the steps for removing the white cap. Again, have your sharp spin ready to catch the used lancet. To release the lancet, hold the white side of the lancing device in one hand and slide the black indented part towards the sharp spin. The lancet will pop out. Follow the instructions to put the white cap back on the lancing device. If you should have any questions, please call our customer service team, who will be happy to support you. On behalf of your Nipro diagnostics team, we wish you safe testing.